Let's call the meeting to order. Roll call. We actually have to say our names, right?
You don't have to do a roll call if you don't want to, but this is our new health board member, Emily Schaefer. The health board approved her a few weeks ago, and the commissioners also approved her. Uh, Emily, would you like to introduce yourself?
Sure. Emily Schaefer. I am the current superintendent for Nettle Creek Schools. I've been in that position for about 3 years, but have been with Nettle Creek Schools for quite some time now. My family lives in Hagerstown, and we have two younger children in the Hagerstown school system. So, yeah.
It's nice to have you.
Welcome. Thank you.
Welcome. What? Okay, and so the minutes for March will not be approved until May.
Our our bookkeeper is on medical leave right now. The minutes aren't typed up, but I want to confirm with her because I typed them up that and then we'll introduce them next meeting. We'll do 2 sets of minutes for next meeting.
Okay. And now we'll have the health officers report.
Yes. All right. So some local trends for you. COVID remains low, and influenza-like illness is now low. Thank goodness. We did have two peaks this season, one in December and one in February, and that's pretty typical. And the heights of this flu season paralleled around the same season levels as 22, 23, but just a slight bit higher. I do need to update you on measles, which I was hoping to not have to talk about again. However, while there are no local cases, the Indiana Department of Health did report a case in Indiana as of yesterday, and that is in Allen County, which is not too far away. There are also cases in Kentucky and Ohio. The best strategy is protection through vaccination. There was also this weekend a second death confirmed in Texas. So this is another child. They have around 480 cases there and 2 deaths. So those are not good statistics. So please make sure that you are protected, and vaccination and information about vaccination is available at the health department and through your doctor and online. So just please be sure you're protected. So for this month, I would like to go back to talking about one of our key performance indicators and how we use the Health First Indiana money. This time I'm going to talk about trauma and injury prevention. This is a multifaceted program that covers multiple areas of focus, but I really just want to narrow it down today and talk a little bit and highlight about how we and what we do to help protect our children of the community. So, safe sleep. We help promote safe sleep practices by collaborating with Birth to 5 and Read Health. Safe sleep behaviors reduce risk of SIDS, or sudden infant death syndrome. Good safe sleep behavior includes placing your baby on their back for all sleep, a firm sleep surface, and to have your baby share your room but not your bed. And then, of course, avoid soft bedding and blankets and toys. The Wayne County Health Department has sleep sacks available. These are also available through partners, and you can always call us for needs. We also like to promote car seat safety. Read Health actually has a community health worker that is a car seat technician and can assist with installation and safety checks, and has car seats to distribute if you can't afford one. And then we also promote safe routes to school through a collaboration with Purdue Extension. They educate on safe routes to school and situational awareness, and can provide safety equipment for families in need, including bike helmets, elbow pads, things of that nature. There are lots of resources on our website to check out. There's actually lots of resources in the community to help protect and provide for our children. So if you have needs or need referrals, please don't hesitate to contact the Wayne County Health Department. And that's it for today.
Anybody have any questions for her?
You want to add on to her with measles? We did order extra MMR vaccines today, so we'll have plenty in stock in case we ever rush since the news is down in Indiana.
God, thank you. Now we have the Deputy Director of Clinical Services report. That's you.
Right. Like they said, we do have MMR on stock, and we have posted on our Facebook page the recommendations of who would need that, who might need another one. If you have any questions, just give us a call and we'll be able to help you with that. And we can do birth to whatever. There's no age requirement to come into the health department, so we can take care of anybody who might need help with that. With regards to our case management, due to a cut in funding through CDC, Indiana Department of Health has given us back any of the case management that they were doing. So there was about 10 types of cases that if of the disease that if they came into our county that the state would handle calling the patients, getting caught up with them, making sure that it was addressed. Because of the funding cut, that's all come back to us now. So we have a little bit more on our plate than we did prior on the case management side. Currently, we have about 148 open cases that we're handling. Of those, the largest numbers are within lead. We've got 67 kiddos that we're monitoring for lead levels. Hep C, which has continued to always be something that we're looking at. 16 LTBIs that we're following. Not all of those are ones that we're treating with the health department, but we do have to continue to manage those cases. And then we've got about 9 Hep B and then some smaller numbers under other areas. Currently, there are 8 flu-related deaths that we have cases on. I don't believe any of those flu was the primary, but flu was a contributing factor. Looking at social media and kind of how we're doing with getting our information out there. If you follow our Facebook page, I've shared this morning on the measles. We've tried to keep up with any of the new trends that are coming out. We've had almost 13,000 views in the last month, 91 interactions. Our reach has been about 6,000, and we have 23 new followers in the last month. So we're continuing to see those numbers go up. So we'll keep pushing those, as well as keeping everything up to date on the website. It's a great resource for anybody who needs information on what we're doing, what we can offer, or what any of our community partners can offer. With regards to some of our numbers for March, we did test, we did 26 TB tests, and we did provide treatment for 3 LTBI cases. Tested 3 lead kiddos. That is, again, something that we can do in office. If they have had an elevated level, they can come back to the health department to continue to get those follow-up testing so we can see that go down. Sometimes it's hard to get into the primary care, so we can get that done pretty quick. Vaccines, we provided 9 for children, 31 for adults. We're anticipating seeing that number go up. With regards to STIs, we did 71 HIV tests, 66 Hep C, 68 syphilis, and 66 gonorrhea and chlamydia. Within those, we did have some positive cases that we did treat. We continue to be able to provide treatment for both Hep C and HIV. That's something unique that not all offices are able to provide. And then looking at our needle exchange program, just some updates on that. We did have 161 participants in March. 10 of those were new. About 11,500 needles came in and about 12,000 went out. 157 doses of naloxone. And for March, we only had 1 dispatch call for pickup of needles. In April, we've already made up for anything that we didn't have in March. So we are staying busy for sure. And then we were able to provide insurance navigation services to 5 patients. So we're continuing to try to work with patients to get them covered if needed. Any questions? We will be starting our a lot of our school clinics too with back to school, kindergarten roundup. So we'll be out quite a bit.
Mobile units are.
Yes. Yep. Our mobile unit is up and running, so you'll be seeing it around.
Thank you. Now the Deputy Director of Environmental Efficiency.
So with housing, we still have several residents living without utilities. We've been in contact with those residents, trying to find them some sort of assistance or different housing. The food portion, this month we've conducted 95 inspections with a total of 312 on the year. But the new food code got approved and it goes into effect on April 16th. The inspector is going to contact the establishments for the info, all the rollout information. We're going to email it and then also provide information. And this is a new type of food code where it's going to be more risk-based rather than being critical or non-critical. It's going to be in and out of compliance. So we have the first two inspectors in the state that were trained, and they're here in Wayne County. So those two guys are with us, and so they'll be able to train our people and then be able to go out and talk to the food establishments. With lead, like she said, we do have 67 cases that we're actively working. Pools and spas, we only have one pool closed. And then with septic, the two that were in failure, the one at Green Mountain Pike, the homeowners now being more receptive. And then the one in Main Street in Williamsburg, they ordered a soil test. So it seems like they're going to try to replace the septic system there. And then as far as animal bites, we just received all of the Richmond Police Department's dog bite reports, so we're logging those. What is it?
You're welcome.
Yeah.
So that's where they go like.
Yes.
Thank you. Which place? That it for you?
That is it.
Okay. Director's report.
All right. To touch up a little bit on what Chad just said about the food code, I just wanted to make the viewing public aware as that takes effect, what you read in the Western Wayne, the terminology will change drastically. So you'll no longer be able to tell if it's critical or non-critical. It's going to be in compliance of how to comply. So when you start reading that in the paper in the near future, it's not going to look the same as it has in the past. All right. The first thing that we covered before the meeting started, Sabrina signed the Board of Health roster for me. And what that is it's a roster of the Board of Health. This is something I have to submit to the State Department of Health every time it updates or at the beginning of the year if it's not updated. So once Dr. Ryder comes back, I'll wrap his signature and we'll shoot it off to the state. Next thing I want to cover is the MOU. I sent the MOU for STI testing for Union County to all the board members. This MOU covers STI testing and treatment for Union County residents. Essentially, we'll have a partnership with Union County. We'll send our people down to Union County to do the testing. We'll bill that patient's insurance. If they do not have insurance, then we'll use our indigent program for testing. If they do become positive, they then become a patient of Wayne County Health Department, and we will treat that patient. All Wayne County residents will come first before we go to Union County. With that said, Union County will reimburse us for any costs that we incur other than manpower. Due to the insurance being billed, we will make money off that insurance, so we did charge them for manpower. But we will charge them for all the tests and supplies, as you can see on the screen here. So the tests are in the above box here, and if they want add-on testing or additional testing, it's in these three categories right here. A positive result from a rapid test, all of these are rapid tests, would require a confirmatory test, and that would that cost would be also incurred, but it would be at the State Department of Health's fee. It's not a fee that we would charge. Are there any questions on the MOU for Union County STI testing or reimbursement for that matter? I'm assuming everybody received my email already with the documents. If there are no questions or concerns, I would ask this brunette come with your motion.
Can I give a motion?
Motion to approve the MOUs.
Oh, second.
All in favor?
Aye.
Opposed? Okay.
Thank you. Our partnerships with the KPIs and Health First Indiana is going well. We voted on a couple months ago to expand the Health's contract, and that has been implemented. They are now starting to invoice and send that nurse through the proper training so she can provide those services. I have a meeting this week with Purdue Extension to go over some of their programming. They have some new staff members. And then we have been asked, there's a leadership symposium in Carmel on the 23rd. They're wanting to spotlight Wayne County and Meade Hospital's partnership. So I'm trying to work that out with Reed Hospital now to secure a speaker. As that goes through, then maybe presented at that symposium on the 23rd. Yeah. It's fantastic. Are there any questions on Health First Indiana or any partnerships that we currently have? So with that said, too, we are meeting with our HFI advisory board. We had a meeting last month, the last Friday of the month. It went pretty well, and we're discussing and coming up with a plan for 2026 and how it's been. Financial report. So these are our budgets that we operate with. Still be small. So the first one is 1161, and that's Health First Indiana. The appropriation here is what we started the year out with, and the unencumbered balance is what we currently have. This data is about a week old because our bills haven't been paid yet. So we still have quite a bit left, and we're on track as far as percentage-wise for the rest of the year. 1168 is a legacy fund. It's a health trust fund. We started off with 114,000, and we currently have 83,000. This is one of the funds that once it's exhausted goes away. It's also one of the funds that we use to fund our Health First Indiana partner, Bert the 5. 4103 is the Health Donations Fund. This was started years ago where people could send donations into the health department if they so chose. And that's what this fund, we started off with a $4,500 balance and presented to about $4,000 balance.
Jump it real quick, Bam.
Yes.
Speaking of donations, we are taking donations for back to school supplies. If you know anybody who wants to donate, so we can provide some of those when we do our back to school clinics.
What kind of supplies are you looking at?
Backpacks, scissors, crayons, pencils, anything that,
Child needs.
yeah, anything that's on those school lists. Blue sets, lots of blue sticks. They always seem to go through those like crazy.
4916 is the local health trust fund, and that was also a legacy fund. And we use it for contractual and professional services, and we also use it for medical and dental supplies. As of right now, we spend about $230,000 to $250,000 a year on that supplies, and it's covered beyond to several different falls. The way it's looking next year is we're going to be limited to Health First Indiana for those because we most likely will exhaust these funds before the end of the year. We're placing our order for this season's, well, we're pre-ordering. We don't know what the strand will be, but our vaccines for this fall essentially, and the order come to just a little over $100,000 just for those vaccines. Kind of gives you a perceptive of the cost of just the vaccine side of things. And that is just for the flu season. Uh, 9164 is the community fund that Reed supplies us to help us with our harm reduction program. We started off with 35,000, and we're down to 19,000. This will most definitely be exhausted. We spend around $2,000 a month in syringes and around $1,000 a month in sharps container disposal, amongst other supplies. 9165 is the 340B program. I've really not touched this much. I've been paying for some of the staff out of different funds, but this round I'm going to have to start using this fund. We started off at 630,000 and we're down to about 612. And this fund, as we treat patients, we make money. That's a revolving fund. 9166 is the school liaison grant, formerly a grant. When we ended that grant, we had a surplus and the state allowed us to keep it, and we have free will to spend this money. He started off with $339,000 and we're sitting at $297 this year. This is how we're funding. One of our medical assistants is a CPR instructor, and we will teach all public and private schools CPR for free, essentially, for staff, administration, and things of that nature. This is how we fund that. The only cost to the school or the person is the American Heart Association fee of $5 for the card, which we can't waive. That goes to our training center and something that we can get away from. So in that aspect, we would ask that that corporation and person write that check to Hamilton County Health Department, which is our trainings. And we will also teach county agencies as well for free. And then 9172 is no longer intact. That was a Harvey Dutcher grant a couple years ago. The white stalls were here. Are there any questions on the budgets or how the dollars are being spent? The contract termination for the testing machines with the CFIN. All right, Chris and I had that discussion earlier, and we've been back and forth with the company. Chris is going to reach back out to the company today or tomorrow, sometime this week, I guess. So since where we sit right now is they want us to pay $8,000 and then return the machinery. I think if that's the case, if we can get that accomplished, I think we'll, since we come out ahead on this ordeal, since they did refund us $62,000. So if I understand, is that correct, Chris? Or Matt? So I'm very comfortable doing that if the board's comfortable with that setup basically on that contract termination. Are there any questions on that contract termination? We're still waiting on the FEP grant. That's the Public Health Emergency Preparedness Grant. As we all know, grants are kind of iffy right now, so we don't know if we'll see that application or not. They do have our letter of intent. As most of you know, our immunization grant was canceled a couple weeks ago, which forced us to move funding because that employed a nurse for us that helped with our clinics. So we had to do some quick collaboration with county council and county commissioners, and both bodies approved us to move funds and personnel over to a different fund, so we were able to retain the part-time nurse that we did have. She will be funded now out of the school liaison grant. And essentially what I did was I took all the training funds and put them into a personnel line, and that's how we'll pay her. We still have training funds in other budgets, so our staff will not go untrained. We're still waiting to hear on other grants. In a meeting today, they said they are unaware of any other grants at this point. So when it comes to our FEMA or a future safety pin grant or any grant in general, it's very unclear right now whether those are going to happen or not. And if they do, the dollar amount will most likely be greatly reduced. Staffing. Our public health nurse position is still vacant, but we did again work with county council and county commissioners, and we were able to move that position to our contractual partner, Virgence. Chris updated contract for us to include that salary and job description with Virgence. And we had 4 applicants, 3 we're going to interview, and we're going to interview those applicants next week now. So within a day or two, to let Virgence know we could use them, they had us applicants ready to go. And all those applicants are local residents. They're not coming from adjacent counties or other cities. Some programming updates. We're continuing to have 340B consultant meetings with our NELCO consultant, Josh. We have those meetings typically on Thursday afternoons, and what he's working for us right now is policies and procedures that will be HRSA compliant. He will basically draft these for us, and we'll approve. The board will approve. They get those in place, but he guarantees all these policies and procedures will pass an audit. I'm holding to them. Credentialing process, we're still working with Certified to have the providers credentialed. We're pretty close to the end of that, but we still can't access our Medicaid portal. I've reached out to about everybody I know to reach out to. If I can't get access within the next 2 to 3 weeks, I'm probably gonna have to reach out to some legislators to see if they can put me in in contact with it, because this is how we bill for Medicaid. The credentialing service needs access to this, the credential our providers. It's an important function for the office. And there's about 20 people from the health department that had access, but none of those people are here anymore. And because they're all gone, it's really been a fight.
So it's just a local, just here?
Here in our health department, yeah. Yeah. So I just sent out an email this morning to a different group of people to see if that could help us. Website numbers. Put those. Here we go. So I know I kind of slacked off the last couple of meetings on the website numbers, but at the top of this, our November numbers was 2,047. December is 2,250. And the only thing I can do is a 90-day review, so that's what I did on my end. And over the last 90 days, we've had an average of 2,895 visits to our website. So we're increasing those numbers along with it. And below, you can see how most people get connected to our website, Google. Google's the chief when it comes to search engine. So what really surprised me is 500 of those sessions come from the county's website itself. I didn't realize that many people visited the county website. That wasn't a pun. That was a true statement. So that's where we are with that. We continue to update it. I believe right now there's still the roaming shelters on there, so I'm going to pull that off and add something else at this point. I know I want to run to it. We have introduced school sports physicals. Those are now active. We have the medical bed, high-low bed being delivered Thursday and installed. And then after that, we can start implementing DOT physicals. So we're on our way. We have all the supplies for it. We're just waiting for the bed to be installed. And due to that bed, our nurse practitioner can start doing pelvic exams too when we're doing SDI exams. The DIS grant. This is what I sent a job description for you. We've had a few meetings with the state. They're essentially proposing that we apply for a grant, we get the grant, we hire a DIS, which is a disease intervention specialist. We have to house that person. They essentially become our employee. The grant is $100,000. Once you pay salary, computer fee, there's nothing left over for anything else. I don't think we're in a place to do this right now. If the health board wants me to pursue it, I will pursue it, but I don't think as a department we're ready for this. We don't have anywhere to house this person. We don't have the technology to give them. We'd have to purchase the technology. We do have permission from the state. We could contract them and make them an at-home employee through the contraction company. But essentially this person would assist with case investigation for STIs and STDs. And essentially that's about it. And they could help with testing. Is that what Beth? I just don't think we're in a place to do this right now, especially with the uncertainty of grants and how, I'd hate to hire a person and have to cancel that 2 weeks later when the grant gets canceled. Beth, you have anything to add on there?
No, they did say this one is up in September. Is this one in September too, or is that?
Yeah, it's sometime this year. We basically, if we decide to do it, we'd have to apply for it, get it, set the budget, and then redo it again. And
Right, 4 or 5 months. So there is a chance we would bring some money on, and they can say they're pretty sure that it's not going anywhere, but right now we can't say.
we were told the immunization.
No one can say anything with confidence that it would go away.
So I would ask the board to make a motion. Dr. Bells, do you have any opinion on this? To make a motion on whether you want the health department to pursue this DIS position or wait for something
So
else.
currently, if anything comes up, you're just doing it with the existing staff that are doing it, and you're able to keep up with the demand, or?
The public health nurse actually does all the case management. So once we get that position back in full time, that will be their primary job. So we'll have somebody full time that's all.
Anything you'll be able to keep up with based on
Yeah, because
history, the demand, or
right now I'm doing case management and we're still kind of above water. So with another full time person and that public health nurse, I think we'll be fine.
I think it's more of a data grab than anything. This person would essentially be reporting to the state using their software for everything. I think it's more of a data grab than anything else.
Even though they would work for us, there is a chance that if the state needed them to work with other, if there was an outbreak or something, they would have the ability to pull them in for that need too.
And it's a regional position. So this person, even though they'd be employed under us, they would work a 6 to 8 county region. So they wouldn't only be assisting Wayne County, they'd be assisting other counties as well.
So you need a motion.
To either pursue the grant or not pursue the grant. Yeah. Do we need a motion for that, Chris? Or
Not if the board doesn't want to take any action, I believe I would need a motion.
Okay.
yeah. Does anybody? I guess does anybody care that we not, or does anybody want me to pursue this? I'm going to take the silence as no, so we'll pass on it until next round if it's offered next round.
Yeah.
Well,
Perfect world. Yeah, right.
so I believe the last thing I have to bring up is our Helmer equipment at the health department. That's our refrigerators and freezers that store our vaccines. Those have to be certified each year, calibrated, so forth, so on. We found a new company called Scientific Refrigeration that will come in and calibrate all of our machinery and supply us with the certifications needed for the State Department of Health for about $800 cheaper than what Helmer was doing it per year. So we have that scheduled for April 22nd to leave. We have all of our equipment recalibrated.
That does not impact anyone to or anything on the
No. Yeah, the person that opened this company is a former Helmer employee, so he has all the certifications and stuff to work on the equipment. Are there any questions over anything that we covered today?
You don't smell good.
Do we have any old business? New business?
No old business that I know of.
No new business, you know of?
No new business.
You will have any comments from the public? Okay. Our next meeting is Tuesday, May the 13th. Ooh. 2025 at 12. Can I get a motion to adjourn?
So moved.
Second.
Thank you. Move the second. All in favor?
Bye.
Yay. Opposed? Nobody. Thank you.